My task today is to introduce Her Excellency Ambassador Hilda Suka Malfudze, who is the Africa Union's ambassador to the United States. Ambassador Suka Malfudze is the permanent representative of the Africa Union to the United States. Her core mandate is to enhance and maintain existing bilateral ties. These ties strengthen democratic institutions, advance trade and investment, knowledge sharing, promote peace and security, mutual relationships between the US and all 55 AU member countries based on culture and shared values. A career diplomat with experience that spans the African continent, Ambassador Suka Malfudze assumed her most recent duties in November 2nd, 2020. Prior to coming to the United States, she helped lead the diplomacy for more than 2 decades in a variety of top government positions in her home country, Zimbabwe. Well known as the quiet champion of democracy, Ambassador Suka Malfudze held ambassadorial positions representing her country in Khartoum and South Sudan between 2010 and 2019, and most recently in the Republic of Malawi. With a staunch commitment to democracy and the will of the people, and I hope she will say something about Sudan in her remarks, Ambassador Suka Malfudze worked fastidiously with the 55 AU member countries to promote and deepen democracy and democratic elections on the African continent. While ambassador to Malawi, she chaired the group of regional ambassadors representing the South African Development Community, SADC, a regional economic community comprising 16 member states. With an agreed objective to coordinate efforts and settle issues of contested national elections, the ambassador engaged deeply with the Africa Union election observers and other international observers. Ambassador Suka Malfudze herself was serving as an international observer. In Khartoum, Sudan and South Sudan, she led important high-level political processes that continue to move the entire region toward greater peace and security. In 2007, Ambassador Suka Malfudze was the executive director of community development, where she was responsible for the day-to-day running of an organization and technical professional staff who interface with government, civil society, and private sector. She worked to ensure civil society needs articulated and streamlined in public policies and programs. From 2000 to 2005, Ambassador Suka Malfudze served as an elected member of Zimbabwe's parliament. As one of the few women parliamentarians, she was an influential voice committed to ensuring Zimbabwe's laws were balanced and served the interests of the poor and other marginalized groups, women, youth, elder, and children. Ambassador Suka Malfudze has a Master's of Art degree in International Relations and the World Order from the University of Leicester, United Kingdom, and a Bachelor of Science degree with honors in sociology and gender development from women's universities in Africa. Located in Marundera, Zimbabwe, WUA is a private university that works to address gender disparity and foster equity in tertiary education while developing knowledge and skills in the areas of vital importance for women. Ambassador Suka Malfudze other professional academic training include the United Nations Senior Mission Leaders Course Interaction. Professional academic training include the United Nations Senior Missions Leader Course Interaction, leadership from the British Council, a professional certificate in networking leadership, diplomacy and mediation skills, leading in conflict environments, and skills for conflict transformation. Ambassador Suka Malfudze is fluent in English, working knowledge in French, and some Southern African languages, including Shona and Ndebele. Ambassador Hilda Suka Malfudze is married with 4 beautiful children. Without further ado, let's hear from our esteemed representative to the Africa Union in the United States.
Thank you very much for a generous introduction, Malfudze. I would say Professor Will Goa, host of the Global Health Catalyst Summit 2021. Mr. Melvin Fultz, President of Constituency for Africa, esteemed faculty and researchers of different high learning institutions, esteemed representatives of international organizations, ladies and gentlemen. It is my privilege and honor to address this distinguished gathering today on the important and critical topic of collaborations to reduce healthcare disparities. Allow me at the outset to express my sincere gratitude to Professor Will Gwa for the kind invitation extended to me. The African Union mission to the US has been participating in the annual Health Catalyst Summit, and it is my distinct pleasure to carry on this commendable tradition and consolidate the existing working partnership between the African Union mission, organizers of the GHC summits. I want to commend the constituents of Africa through its president, my brother Melvin, for the important contribution to enhancement of US-Africa strategic partnership during the last 3 decades. Thank you for your continued service in the leadership, my brother. This GHC summit is taking place at a crucial moment when the entire world is forced to adapt to the new reality caused by the impacts of the COVID-19. Nearly 2 years into the COVID-19 pandemic, the virus continues to replicate, and the new variants pose an ongoing risk. COVID-19 has left more than 5 million dead to date and has devastated communities all over the world. The pandemic is still ravaging the global economy and local livelihoods and disrupting a global supply. Global supply chains, constraining global mobility, and threatening global peace and security. The unprecedented global pandemic of COVID-19 has demonstrated not only the strong linkage between the economy and health, but above all, the fragility and vulnerability of our humanity. The multidimensional crisis is also tested, in my opinion, our commitment to the values of international solidarity, global health security, equity, and partnership, so that together we can overcome the pandemic and build a safer world for all. The COVID-19 pandemic has arguably intensified the risks facing the continent as we speak. The peace, security, governance, and resilience priorities were impacted by the pandemic through the upscale of violent conflict, disruption of mediation efforts, postponement of elections, in some cases, and a surge in human security threats, especially the rise in domestic violence, sexual and gender-based violence, economic and food insecurity. The pandemic caused an unprecedented disruption in the global economy and a tremendous impact on welfare and the livelihoods all over the world, including Africa. Before the COVID-19 pandemic, Africa was riding nearly a decade of progress with economic growth, stronger governance, and a drop in violent conflict. As a result, 27 African countries had attained middle or high income status. The continent posted an 11.4% return on foreign direct investment, well above the global average of 7.1. In fact, much of the progress achieved in recent years in the areas of education, health, and poverty eradication has been halted or reversed by the COVID-19 pandemic, impeding the achievement of many of sustainable development goals in some African countries. Although the impact of the pandemic has varied among African countries, it has increased the proportion of people at risk of falling into poverty and exacerbated inequalities across the continent. To address all these critical challenges, African countries are fully cognizant today that their policy responses should not be enacted merely to facilitate a return to pre-COVID-19 status, but also to encourage investment in new areas so as to build greater resilience, increase productivity, and ensure long-term growth. The nature and scope of the COVID-19 pandemic have illuminated key challenges in global coordination and cooperation on responses at scale. Regional coordination before and during the pandemic has enabled some regions to better plan, assess and share resources, leverage scale, aggregate capital, and purchasing power for the procurement of vaccines, and make smart investments for the future capacity. In this regard, regional organizations such as the African Union serves as a critical building blocks in the global architecture for health security. We need national, regional, and the global platforms to prevent, detect, respond to COVID-19, address future health security threats. Africa and its premier continental institution, the African Union, have provided an eloquent example or lessons, if one might say, on how to move away from using uniquely state-centric and a fragmental approach to adopting a coordinated, sustained, and robust regional and multilateral strategy in combating this virus. Since the declaration of the COVID-19 outbreak, the African Union, through Africa CDC, took the lead by coordinating several continental strategic initiatives to support member states in their preparedness and response, and mobilize international economic support for continent fight against COVID-19. Strengthening African countries' weak health systems, increasing investment in digital technologies and innovation, and fast-tracking the effective implementation of the agreement establishing the African Continental Free Trade Area, which will support economic recovery. They will enable African countries to thrive in a post-pandemic world and create the critical mass of high-skilled people to design technologies that create the conditions for job creation. Throughout the course of the pandemic, Africa has seen an increase in innovative solutions, including virus testing robots, contact tracing apps, non-invasive testing kits, foot-operated hand washing stations, oxygen machines, drone, medicine delivery service, genome sequencing, and much more. Many of these and other innovations were made by micro, small, and medium-sized enterprises. However, it is important to underscore that access to COVID-19 vaccines remains a dire need, as less than 6% of the African population is fully vaccinated. A cause for concern for all of us who come from the African continent. The global supplies of vaccines are critical to attain global herd immunity in the fight against the COVID-19 pandemic. This is critical to opening up across countries, global health and security, and global swift economic recovery. Even if it concerns us as Africans, it should concern also the whole world, as we have become one, we have become globalized. I go on to say global vaccine supplies would also be a distinct mark of global solidarity to fight an common enemy. Allow me to take this opportunity to thank the Biden-Harris administration for the important support provided to African countries to produce vaccines. We believe that no one is safe until everyone is safe. There is a serious need for Africa to take control of its own health security so that countries can shape their future health. Strong public health institution supported by the Africa CDC, which is doing a tremendous job during this unprecedented COVID-19 pandemic time. Ladies and gentlemen, because of the COVID-19 pandemic, all efforts in the health sector are focused on the fight against the COVID-19 pandemic with the tendency to eclipse other diseases. I am pleased that the GHC summit is focusing on non-communicable diseases like cancer, mental health, pain, and cardiovascular diseases which are severely impacting global health and economic development. In the health sector, the African Union developed in 2007 the first African health strategy of 2007 to 2015. The strategy was revised to integrate research and innovation for health and was extended from 2016 to 2030. The current African health strategy is built on a number of continental and global health policy commitments and instruments. Among these are Agenda 2063, the Africa We Want, and 2030 Agenda for Sustainable Development. Other policy frameworks from which health strategy reinforces include the sexual and reproductive health and the rights continental policy framework and its revised Maputo Plan of Action of 2016 to 2030, the Pharmaceutical Manufacturing Plan for Africa, the African Regional Nutrition Strategy 2015 to 2025, the various EU Abuja commitments aimed at combating AIDS, tuberculosis, and malaria in Africa, the catalytic framework to end AIDS, TB, and eliminate malaria in Africa by 2030, as well as the Global Strategy for Women's, Children's, and Adolescent Health 2016 to 2030. Its strategic directions require multi-sectoral collaboration, adequate resources along with leadership to champion its implementation and ensure effective accountability for its results. There is a need to ensure that investments are made in these three following strategic areas. Health systems is one, health system strengthening is one, two, generation and the use of evidence for policy and program interventions, and three, advocacy and capacity building. In addition to health strategies, the African Union has established in 2017 Africa CDC, the first specialized technical institution that supports public health initiatives of our member states and strengthen the capacity of their public health institutions to detect, prevent, control, and respond quickly and effectively to disease threats. The second specialized technical health institution of the African Union is the African Medicines Agency. The treaty for the establishment of the African Medicines Agency entered into force on November 5, 2021, 30 days after the deposit of the 15th instruments of ratification. The mandate of the African Medicines Agency is to facilitate harmonization of regulatory requirements and produce practice among the national medicines authorities of the AU member states. The African Union Commission continues to encourage all its member states to sign and ratify the treaty for the establishment of African Medicines Agency in the interest of health, safety, and security. These two specialized technical health institutions established at the African continental level are opportunities for the public-private partnership. It is in this perspective that I strongly invite the US private sector to partner with Africa and take advantage of these opportunities. My appeal goes also to my dear brothers and sisters in the diaspora. Your contribution in terms of skills, expertise, connections, and transfer of knowledge is invaluable. You are our hope for a better Africa of tomorrow. You have the tools, you have all what it takes to uplift Africa, to create hope through job creation for your young brothers and sisters on the continent. We expect a lot from you. Africa is making bold choices and critical investments in the regional integration process that will pave the way for the next generation. For the next generation of African workers, inventions, and entrepreneurs to innovate and thrive. The current moment, in spite of the critical challenges we are facing, offer the continent a leapfrogging opportunity to build an integrated and inclusive digital economy and enhance socio-economic transformation of the continent. The role of diaspora is key for the transfer of technology and the development of partnership to support the transformation of the continent. Africa would also require all the necessary support from its closest partners and allies, particularly the United States, to build forward better from the damaging consequences caused by the COVID-19 pandemic. I want in closing to reiterate the strong commitment of the African Union Commission to take Africa-US relations to a higher level of engagement that reflects long-standing historic and the cultural relations between our nations. Thank you. Congratulations for a very successful summit. Thank you for listening.
Thank you very much, Madam Ambassador. We've been running into each other at all the Washington events recently, but we never have had the chance to sit down and talk. And I'm looking forward to that opportunity, perhaps after the holidays. We can bring the diaspora over to you or arrange a Zoom so that we could drill down on some of the things that you're outlining. I want to take a few questions, if you don't mind, and I want to start off. I'm happy with your, the fact that the diaspora is very much a part of the Africa Union strategy. I've been working on this for a long time, and in fact was in South Africa for the Diaspora Summit in 2013. And one of my biggest disappointments is that we haven't fully gelled yet. Now maybe this is a 100-year strategy, and maybe I'm a little bit too impatient. But what do you think about this diaspora, and where does that fit into your strategy as the AU ambassador to the United States? What is the importance of the diaspora? You mentioned the fact that we can provide technical assistance and we can invest certainly and do some of these things. But what role do you envision for the diaspora in Africa's sixth region?
Yeah, diaspora is as you have just said, is our sixth region, which actually says we have branded as an important entity of the African Union, having 5 regions on the continent and calling the diaspora as our 6th region. That actually also tells you, we are saying it doesn't matter you are at a distance to the continent, but we all come from there. We all have roots that connect with the African, and it's about the interest of the diaspora at the end of the day. As you may know, the meaning of our diaspora, it is all those who were born on the continent, all those who have left the continent at some point in time, maybe before we even coined the word diaspora, at some point in time, all those who have their roots on the continent fall under the diaspora in meaning. And to me, the diaspora will make a difference. And as you know, usually when people leave the continent and they come to work here, they have this experience, the experience that they get from working from here. They come here to study, and at the end of the day, the continent is not getting what is due to them. These are our children. And those who have come even from time immemorial are still the children of the continent. And they should also develop the interest to invest on the continent. They should have the ownership. They should also have the belonging and also have the right and the choice to choose where they may want to do the investment. They are the children of Africa. And we say to ourselves, these are the people who make a difference to the Africa that we want. And as you know, Melvin, this year we branded it as African Union, a cultural arts and heritage, which we have branded as levers for building the Africa we want. We have been running around with issues to do with culture, but in the same vein, we are saying the expertise that we even have here of our children. When I say our children, I'm meaning everybody who belongs, who have roots from Africa, having them put their expertise in place to allow the young brothers and sisters who are on the continent to be employed at the end of the day, and for even to teach them. It's in all fronts. that contribution from the diaspora can be effective and really being accepted on the continent and celebrated, let me not say accepted, but celebrated on the continent. It's the expertise that the diaspora has, which we are embracing. So this is your time, diaspora. You have to show belonging. You have to make a difference. We are all calling out on the Africa that we want. We are putting all in place to make it a better place to live. Play your part too and make a difference to this continent of, beautiful continent of ours. Thank you. I think
what you make some very strong points, Madam Ambassador, and I certainly agree with you. You know, when I look around this country, I see there are 50,000 Nigerian health professionals, doctors and nurses, and 50,000 of them in North America. And many of them they're not at your general hospital. If you go to the top medical centers in this country, you go to Stanford, you go to Harvard, you go to some of the best health centers in the United States, you're running into a Nigerian there doing research, or the orthopedic surgeon, or doing brain this and thing. It amazes me. 20,000 Ghanaians, everything from nurses to, you know, name it, from Ghana. You know, you go to senior citizens home and you'll find a lot of Africans sitting there. One of the questions I have is a how question. You know, I look at Cameroon, you know, and Will Ngwa, he's a Cameroonian. You know, you got the most brilliant, you know, expertise who are saving, you know, I want to say the Mzungu, you know, they're saving the Mzungu over here. When in fact, using technology, you know, maybe telemedicine is one avenue. Maybe they could still sit over here and deliver healthcare in Africa some kind of way, training, capacity building. What do you think about this?
Yeah, I agree with you. It's the reason I said all those are our children. They're all here saving Mzungu, yes. And we are saying, okay, that is positive. Life has to keep going and we have to build on our academics and shape ourselves and be somebody at the end of the day. But having that sense of belonging and saying, let me make a difference is important. It's very important. And we have, yes, I've been a year here and I've bumped into many Nigerians, many Ghanaians, and I'm saying we shouldn't be found wanting as Africa. We shouldn't be found wanting. We are not going for issues of specifics that go and set up a health system on the continent. Take that expertise that you have and let's partner with another one with the expertise that is in the health system itself and put together, maybe also just get these young people from the continent, have the zeal, maybe not getting them to come here, which is expensive, but you to get on the continent and do a training. It can be a short-term training, just train them and the member states facilitate for you being on the continent and they select a certain number of students who come to be trained. By so doing, we are imparting that expertise that we have. That's what we are just looking at. Strengthen your own, have that sense of belonging, and they say to yourself, we want that Africa that we want. Let it be shaped by us, the Africans, at the end of the day.
I have another question around the U.S.-Africa policy. You know, we have a new administration in the White House, Joe Biden and Kamala Harris, and certainly there are a lot of good people in the administration who want to support Africa. What do you see as the role of the U.S. government? What would you like to see the Biden-Harris administration do that would be an initiative to strengthen Africa's healthcare system? What can they do, not a matter of just window dressing, but structurally improving the health conditions on the continent?
I want to think they are playing a very good role at the moment. And as I said, not so many people are vaccinated on the continent. And we're trying by all means to be sourcing these vaccines. But who has been our biggest donor is the Biden-Harris administration on the continent, which has made a difference. I would want to say in that vein, and with this integration that we're talking about, the African Continental Free Trade Area and the integration we're talking about, the Agenda 2063, which has its flagships, which include also the health system. We are saying they should work with us to strengthen that, to say this is what Africa has chosen to do. These are stages that we have taken right now to say we want our health system to be 1, 2, 3. And as we integrate, we also integrate the health system and what is required in integrating all so many areas. It's not only the transport, it's not only building the roads, it's the digitalization as well. We are looking to have that expertise on the continent and to have the US help us, work with us, let me put it that way, work with us to make it stronger and for us to be able to also have the technology that is being used here to make ease and simpler ways of integrating and have it on the continent. That's what we would want from the Biden-Harris administration at the end of the day. Help us grow. We are in that mode at the moment. We have put in place what is required for us to get to a certain level. So let's move it further and strengthen. And as I'm here to strengthen the relations through Africa and the US, I think that's one big point that we're looking at, to say the Agenda 2063 is its flagships. There are so many areas that the US Biden-Harris, Kamala Harris administration can do.
Yeah. You know, many of us who work on Africa and support Africa, I've always thought that, we thought with HIV/AIDS, that would be an opportunity not only to address HIV/AIDS in Africa, but to build Africa's health capacity. We thought the same thing with Ebola. You know, as dreadful as that disease was, some of us were thinking beyond, you know, we felt we could build a global response to it. And, you know, that would be the opportunity for Africa's healthcare systems to finally be what they should be, you know, the Agenda 2063.
Yes.
Well, we felt the same way. Some of us feel the same way about COVID-19. As bad as that disease is, and we all know, we've all felt it and know how devastating it's been to the globe. Is this an opportunity to build Africa's healthcare? There's something is wrong, and I can't quite put my finger on it. You know, we talk about 55 countries in Africa.
Yes.
Well, you know, maybe because we got 55 countries, that means we can't cooperate. You know, we got to always have our armies facing each other. We got to always, you know, compete with each other as opposed to what do you think about that, Madam Ambassador?
No, I don't think there is a 50. That's why we're saying we have all that it takes as Africa. And as I was saying, it's in all fronts that the diaspora can be of help, besides also having our bilateral relations with the US. There's a lot that can be done on the continent. People can have, can appreciate in each and every country, there's endowments on the continent. And it should be easy for us to be fusing, I mean, in making a difference, not only mutually benefiting difference between the US and Africa, and also with the involvement of the diaspora. I don't know if I responded to you properly or you phrased your question.
It was a very complex question, I assure you.
Yeah, it is.
One other thing, I'm going to open it up. A lot of the African immigrants are here, and many of the health professionals that you would meet, such as these Nigerian doctors and Ghanaian doctors and Kenyan doctors and so forth, will tell you that they can't go home because they go home, they would be seen as part of the opposition, some kind of way. They won't have the equipment and the technology that they may be accustomed to over here. So the reason for going home is, you know, economic and political. You know, I mean, I think telemedicine is one of the answers. You know, maybe you can't go back to your country, but you can certainly get on your computer and do your thing to help train and build capacity and share books and that kind of thing. But what do you think about that? That is a real concern for many of especially the immigrants from African countries.
My comment on that is, I cannot say someone may have come across that experience when they went to their country in Africa, but I would want to say that should be a thing of the past. That's an old story. Let me put it that way. It's an old story, and it shouldn't, at the moment, even if it's an old story, it just doesn't, it's not giving us anything at the moment, because what we are looking at is Africa. We are past all those stages. Yes, there could be some suspicions, you can be opposition, you can be a ruling party, you can be whoever. But I think the member states and the leaders in the member states have gotten to that point where they are telling themselves, we have to rise above all machinations and be a people. If we are talking of the diaspora, and if we're talking of just short of the word to explain what it is, but countries have been sustained in Africa from the monies that are sent by these immigrants who have left the continent, and they've sent monies and they've sent real dollars on the continent. And that has sustained the government. And also I would just implore and say, governments should grow now and tell themselves, you cannot, the world has become globalized. You cannot stand in the way and say, you have to do as I want for you to be able to contribute. It's like if I set up a business, I can give it as an example. I set up a business. I cannot say I don't want an opposition to come and buy in my shop. I'm doing business. I think right now Africa has gotten to that stage, the African Contractual Free Trade I'm talking about, which has gotten the support of the 55 member states at the moment. All those areas, they are getting to strengthen themselves and to know that if we want to grow and if we want to make a difference in our countries, it's to open up. You open up by what? By just saying, we can't like check each and every person who is coming in and say, are they opposition? Or we could check for other things, extremism maybe. But for your child who has come back to invest, if he's coming from the opposition, he supports the opposition and he's coming to invest, who will benefit? It's all our children, not only the opposition's children. And as you suffer, all of you suffer, the ruling party and the opposition, the children from the ruling party, the opposition will suffer. And we are saying they are growing. It's not like it was 10 years ago, believe me, or maybe I can say 20 years ago, but believe me, they're scaling themselves up. They're getting somewhere. They know what it requires. What do we need to do to be at that stage, the global stage, and have Africa's voice be listened to? We are managing the 55 member states to make decisions as 55 member states and saying we come up with one candidate for any position that they want internationally. And if we're saying we want to grow our economies in the integration, we have to all fuse and be accepting the integration that we're talking about. There's no way you can be left behind and they talk of, I don't want the opposition. The opposition also is from your country. Find a way to work with them. So it may be happening, it may have been happening, but I think people are upscaling. Let me put it that way.
Okay. Let me call on Twaib Nguma, who raised this question, and I'm gonna give you an opportunity to pose your question. Go ahead.
Madam Ambassador, thank you very much for your presentation. My name is Twaib Ngoma. I work in Tanzania, and I also have been an external examiner in Zimbabwe. I know a little bit of Zimbabwe. My question to you is regarding us in Africa, not the diaspora at the moment, because you have talked about the diaspora. There is a good positive step about the CDC Africa, which is helping us and will help us even more. And I wanted to ask you, the role of the African Union in helping the African countries to strengthen their weak health systems, also to see whether we can have universal health coverage and equity in the continent. I think you have a big role. If we are talking of one continent, 55 countries which are working together, and these things like having leadership. Yes, leadership to me seems to be very important when it comes to implementing any plans.
Yes.
Strong leadership. And at the AU, where you have the heads of state, you have the ministers of health, if we had a good communication strategy, and if whatever we wanted to do was communicated such that everybody was on board, I'm sure even without extra dollars, even with the dollars that we have, would make quite some progress.
Yes.
So I wanted to hear from you, being inside the AU,
yes.
and also knowing very much about the problems that we face in Africa, and some of the problems that are really within our own capacity,
yes.
because we can do more, even with the resources that we have.
Yes.
What are your views about coverage, universal health coverage, equity, and leadership, and having a good communication strategy that makes Africa work better than it's working now? Thank you very much.
Yes, you said coverage, equity, and
leadership.
Leadership?
And health systems strengthening.
Yeah,
we have very weak health systems.
I can't agree with you more. You know, we should also, in the whole process, thank you for your question. It's a very good question. And I mean, we are all yearning to have the good health systems in all our countries. At the same time, I would want to give due credit to Africa CDC with the work they did during the peak period of the COVID-19 pandemic. To me, that showed if we put our heads together as a continent and the leadership wanting to achieve what we want to achieve, we can do and we can make it. You are right that the health systems are just, the populations are growing and it's not commensurate with the way we are moving with the health systems. It goes back to what I was talking about when my brother Melvin asked it about, what do you want, what are you looking at for US to do on the continent in regards the health systems? These are the areas, my brother. I mean, in terms of the Africa Continental Free Trade Area, we have said this is business. And I told you it's all in all fronts where we want to integrate. And if we could have a system like the system that was put in place, that has been put in place by Africa CDC to scan each and every country, where are we, what are we doing? I think we'll be headed for greater heights. We need to put a lot in place at the moment. I mean, in terms of all those areas you're talking about and the equity that you're talking about, the coverage, I think Africa CDC covered the whole continent. I give them, thumbs up. They covered the whole continent. And I would want to think that same system, if we can put it in place, my brother. And I know Africa CDC was working with you, even in Tanzania, in making sure that we know what is it in Tanzania. We may have had problems at the beginning, but with the time we knew what was on the ground in Tanzania, in the direction to take to make that difference, to ensure everyone is vaccinated and all that. But I would want to say it will require these resources we're talking about. It will require this foreign direct investment for us to shape, to put the health systems that can be commensurate with the populations that we have at the moment. As regards the leadership, so far, it has been a situation whereby nobody wants to be left out. With a decision that is made at the African Union level, to say this is what is, I'm just giving as an example, this is what Africa CDC wants and what they are doing, and they want to help work with the health ministers and the technical side of the health ministries, of the countries in the continent. It has really happened that all the member states came into the fold and said, this is what we want. This is how we're moving. So I would say, my brother, it requires a lot, but I'm happy to say we are now moving. We're speaking with one voice in what we want on the continent. I may not be able to get deep into what can we put on the table, but it's a very good question, which I'm also going to research on as I'm within to say what should be done. Because the topical issue at the moment is the health, what health systems, what do we do with our health? There's importance for all other things to fall in place. We'll have put our health in order for us to get there. But it's doable. In short, that's what I should say. It's doable, but we put in place at the moment what we're putting in place even with the African Contract Free Trade Area, the one system, single aviation system that we've put in place, and all these things that I've put in place, I've mentioned. I think also the push should be coming from the member states to say this is what we want, 1, 2, 3. How can African Union make it happen so that there's equity in the whole economy?
We really need that. We're talking about.
We're out of town. I'm sorry, we're out of time, and Will is telling me they're going to cut us off in a hot second. And I want to give the ambassador. First, I want to say also, Ambassador, we're working closely with John Nkingasong from the Africa CDC, and as you know, he's being considered to be the head of PEPFAR, which we're all happy about. You know, another example of an African who will be over here, but we want to make sure he works over there too. But we're already talking about activities that we could bring together the Africans who are in the healthcare in the United States and from the diaspora to do some roundtables. Maybe we can work directly with the AU mission to coordinate some of these in 2022. And I'm going to be talking to Dr. Ngwa and others, but maybe we can do some activities to link up the Nigerian Physicians of North America, the National Medical Association, and all the other African health groups here in the United States, so we can do a better job of assisting and coordinating. So I look forward to working with you in that regard. Do you have any closing remarks to this audience? I can assure you also that this video is being seen by some really quality people, and I know Dr. Ngwa and his staff are planning a massive distribution of it across the country and throughout the diaspora to make sure everybody here's what you had to say about this important topic. But I want to give you a chance to say your last words before we close out.
I would just want to say Africa is yearning to be at the global stage in that decision making that is being made at the global stage. And what are the tools to get us at that, to have their voice be listened to? It is the diaspora at the end of the day that will make that difference, and then make that difference on the continent, make that difference wherever they are. Now we can have trainings being done through the Zoom, through virtual and all that. So I would want to say, do more, even virtually, for the continent to benefit. I think that's it.
Well, thank you very much, Madam Ambassador. Enjoy the holidays that are coming up. And I look forward to sitting down with you soon to have this conversation about the strategy going forward.